get ready for this deep dive. The official COVID death toll, right?
Yeah.
Over 1.1 million in the US.
Yeah.
Well, what if I told you that that number is likely significantly undercounted, like by a lot?
Oh, wow.
Yeah, we could be talking almost 180,000 people. That's a huge number.
Yeah, that's a big difference.
So today we're going to be looking at excerpts from a Slashdot article that discusses a study from PNAS, that's the Proceedings of the National Academy of Sciences.
Yeah.
And we're going to be diving deep into this to see what it tells us about the potential undercounting of COVID-19 deaths in the U.S.
I think this will be a really interesting deep dive. I'm ready to learn more.
Yeah, me too. So the study found that the actual number of COVID deaths is likely 16% higher than what's officially recorded.
Wow, so that's where that 180,000 number comes from.
Exactly, and it's pretty unsettling when you think about it.
It is.
So how did they figure this out? The study looked at what are called excess deaths.
Right.
Can you explain what that means?
Yeah, so basically, every year, a certain number of people die from natural causes, right?
Right.
But during the pandemic, there was a huge spike in deaths above and beyond what would normally be expected, and that's what they call excess deaths.
So they weren't just looking at deaths that were specifically attributed to COVID, they were looking at the overall increase in deaths from all natural causes.
Exactly. And that's how they were able to estimate that the true COVID death toll was actually much higher than what the official numbers showed.
That's fascinating. And I think it's also important to mention that this study focused specifically on deaths from natural causes. So they excluded things like accidents or homicides.
Right. They wanted to isolate the impact of the pandemic itself.
Now, one thing that really stood out to me in the Slashdot comments was a story about a coroner in Missouri who refused to list COVID on death certificates without a positive test,
Oh, wow.
even if the symptoms and circumstances pointed to COVID.
It makes you wonder how many other cases like that might be out there.
Right. It's kind of a microcosm of the larger problem of potential undercounting.
It is, and it shows how individual biases or interpretations can affect even something as seemingly straightforward as recording a cause of death.
Exactly. So the study identified two main reasons for this potential undercounting, and one of them is pretty obvious. Early on in the pandemic, there was a lack of awareness and testing.
Yeah.
So a lot of people might have had COVID but never actually got diagnosed.
Right. So especially in those early months when testing was so limited.
Exactly. And so their deaths might have been attributed to something else entirely.
And the study actually found that excess deaths started rising slightly before the official COVID surges were being reported.
Oh, really?
Which suggests that COVID was already circulating and claiming lives before we even had a good grasp of what we were dealing with.
That's kind of scary to think about. It's like we were flying blind for a while there.
Yeah, it really underscores how quickly things were changing and how much we were still learning about the virus in those early days.
So what about the second reason for the undercounting? I know the study mentioned something about deaths happening outside of hospitals.
Yeah, so basically there was a rise in out-of-hospital deaths, particularly in places like homes and nursing homes. And attributing a cause of death in those settings can be more difficult, especially if, testing wasn't readily available.
Right, because you might not have a doctor there to make a definitive diagnosis.
Exactly. And
Right.
so it's possible that some COVID deaths were misclassified as something else simply because they didn't happen in a hospital setting.
So you're saying that even if someone had all the classic COVID symptoms but they died at home, their death might not have been officially counted as a COVID death?
That's a real possibility, and it's something that the study authors specifically pointed to as a potential factor in the undercounting.
So we've got a couple of key factors here, limited testing early on, and then this issue of out-of-hospital deaths. And both of those things could have contributed to a significant underestimation of the true COVID death toll.
Right. And when you combine those factors with the potential for, individual biases like we saw with that coroner in Missouri, it starts to paint a pretty complex picture.
It does, and it makes you realize that the official numbers might not tell the whole story.
Exactly. And that's why it's so important to look at the data from different angles and consider all of the potential factors that might be at play.
Okay, so we've talked about the undercounting, the reasons behind it, and I think it's time to start digging into what this all means. Why should we even care if the official death count is off by a certain percentage?
That's a great question. And I think it gets to the heart of why this study is so important.
Sure.
Because it's not just about statistics. It's about real people, real lives lost.
Exactly. And understanding the true scale of the pandemic's impact is essential on so many levels.
Yeah. For example, we're still grappling with the long-term effects of COVID, what we now call long COVID.
Right.
And if a significant number of COVID deaths were missed, It stands to reason that the number of people experiencing long COVID might also be underestimated.
That's a good point. If we're not accurately capturing the number of people who had the initial infection, how can we accurately assess the prevalence of long-term complications?
Precisely. And that has huge implications for things like research funding support systems and even just how we approach addressing long COVID as a public health issue.
It's almost like we're looking at a blurry photograph of the pandemic, and this study is helping to sharpen the image a little bit.
I like that analogy, and it highlights the fact that data, even official data, is always evolving as we learn more.
So this whole issue of the Missouri coroner, it really sticks with me. It's like a microcosm of the larger problem.
It is.
We've got gaps in testing variations in death investigations, and then you add in these individual biases, and it makes you wonder how much of the undercounting was due to these more subjective factors.
Yeah, and it really underscores the need for clear, standardized protocols for death investigations.
Right, we need to minimize the potential for subjective interpretations to skew the data.
Exactly,
Yeah.
because at the end of the day, we need data. We can trust data that accurately reflects what happened so that we can make better decisions moving forward.
Okay, so let's shift gears a bit and talk about the bigger picture.
Okay.
We're talking about a global pandemic, an event that touched every corner of the world, and we're still trying to piece together the full picture of its impact.
And to be fair, pandemics are chaotic and fast-moving by their nature,
Right.
gathering perfect information in real time,
Yeah.
especially when you're dealing with a novel virus. It's incredibly difficult.
That's true. And I think this study does acknowledge the efforts that were made to improve surveillance over time.
Yeah,
But the fact that this undercounting likely occurred, it highlights just how much work we still have to do to strengthen our public health infrastructure.
absolutely. We need to be thinking about how we can better prepare for future health crises.
Yeah.
How do we ensure that our public health systems are resilient enough to provide accurate and timely data,
Yeah.
even under extreme pressure?
Yeah, that's a big question and one that deserves serious attention.
It-
We need to be advocating for better public health resources, supporting scientific research, and promoting clear, evidence-based communication.
I completely agree. And we also need to be critical consumers of information,
Right.
always considering the source, the potential biases, and the limitations of any data set.
So for everyone listening, we'll leave you with this final thought. Given this potential undercounting of COVID-19 deaths, how might our perception of long COVID and its prevalence be affected?
That's a good question to ponder, as we continue to learn about the long-term consequences of the pandemic.
It is, and we encourage you to check out the original study and explore some of the resources that we'll link in the show notes.
Absolutely. Keep learning and stay curious.
And that's a wrap on our deep dive for today.
Thanks for having me.
Until next time, keep learning and stay curious. So it sounds like there's a chance that some COVID deaths were just misclassified because they didn't happen in a hospital.
Yeah, it's definitely possible, especially, early on.
And wasn't there something in the study about the undercounting not being the same everywhere in the U.S.?
Right, it wasn't uniform across the country. Non-metropolitan counties, particularly in the West and South, they were hit harder by the undercounting.
I wonder why that is. Did they have less testing in those areas?
Testing was part of it, but it's more than that. These areas often just have fewer resources for investigating deaths in general.
Like, what do you mean?
Well, think about it. Fewer medical examiners, less access to, advanced tools, and even just different ways of filling out death certificates.
So it's like a whole bunch of things coming together to create this problem of undercounting.
Yeah, you've got limited testing deaths outside hospitals, and then these regional differences in how deaths are investigated.
It's complicated.
Absolutely. And it really shows that we need to put more resources into public health, especially in rural areas and underserved communities.
Makes sense. If we want good data, we need good systems to collect it no matter where you live. Okay, so we've talked about the undercounting, why it happened, the regional differences, but what does it all mean? Like, why should we care if the death count is off, even if it's by a lot?
That's the key question, isn't it? Because this isn't just numbers we're talking about. These are real people, real lives.
Right.
And knowing the true impact of the pandemic, it's important for so many reasons.
Like, what are some examples?
Well, we're still dealing with long COVID, right?
Yeah.
If we missed a lot of COVID deaths, it makes sense that we might also be underestimating how many people have long COVID.
I see what you mean. If we don't know how many people got infected in the first place, it's hard to know how many people might have long-term problems.
Exactly. And that affects everything research funding support systems, how we even think about long COVID as a public health problem.
So maybe we're not giving it enough attention or resources?
Possibly,
Yeah.
and this undercounting, it also affects how we prepare for future pandemics.
Uh.
Well, if we don't have an accurate picture of what happened in the past, it's harder to make good decisions about, resources policies, even how we talk to the public about risks.
It's like we're looking at a blurry picture of the pandemic, and this study is helping to make it a little clearer.
I like that analogy. It
Yeah.
reminds us that data, even official data, it can change as we learn more.
So this Missouri coroner example, it keeps coming back to me.
Yeah.
We've got the testing gaps, the different ways of investigating deaths, and then on top of that, you have individual biases, maybe even some outside pressure. It makes you wonder how much of the undercounting was because of these subjective things.
It's a good question, and it really shows how important it is to have clear rules for investigating deaths and to make sure everyone involved is trained properly.
So we can reduce the chances of personal opinions affecting the data.
Exactly. We
Yeah.
need data.
Yeah.
We can trust data that shows us what really happened so we can make better choices in the future.
This really makes you think about the big picture, doesn't it? I mean, a global pandemic, something that affected everyone, and we're still figuring out what it all means.
And, pandemics are chaotic by nature, trying to get perfect information when it's all happening, especially with a new virus. That's tough.
Yeah, that's true. And the study does mention that things got better over time, like the way we tracked cases.
Right.
But the fact that we probably undercounted deaths, it just shows we have a lot of work to do to improve our public health system.
Absolutely. We need to think about how to be ready for the next health crisis.
Yeah.
How do we make sure our systems can handle the pressure and give us accurate information?
Yeah, that's a huge question, and we need to be talking about it.
Definitely.
We need to push for better resources, support research, and make sure people are getting clear information based on science.
I totally agree, and we need to be smart about the information we see. Think about where it's coming from, if it's biased, what the limitations might be.
So for everyone listening, our final thought for you, if we undercounted COVID deaths, what does that mean for how we understand long COVID and how common it is?
That's something to think about as we keep learning about the long-term effects of all this.
It is, and we encourage you to read the study for yourself and check out the links we'll have in the show notes.
Yeah, keep learning, keep asking questions.
That's it for our deep dive today.
Thanks for having me.
Until next time, keep learning and stay curious.